My name is Larry Harris. I'm semi-retired. Long story short, a lady walked in front of me and she wasn't watching, and to keep from hitting her, I swerved hard to the left and there was a post there and I hit the post with my right pedal and I went flying. And to say that it changed my life at that time is an understatement. It's the toughest thing physically that I've ever dealt with in my life. You know, I've been very limited up until really the last month, 6 weeks. And it's just, you know, it changed my life. When I was in the hospital, the pain that I was enduring, they really didn't understand how to medicate me. It was actually the following day after, you know, that I saw Dr. Swift, and, you know, he just said, Larry, we're gonna do this surgery.
My name is Dr. Robert Swift. I'm an orthopedic surgeon here in Naples, Florida. So I met Larry Harris in the hospital. He was involved in a bicycle accident. He had significant pain in about the area of his pelvis. Emergency department ended up getting CT scans of his pelvis, and he had a significant injury to his sacral iliac joint. He was very uncomfortable. He had a lot of pain. You know, flexing his hip or externally rotating his hip created significant pain to the posterior pelvis and anterior pelvic rim. So that's when we diagnosed him with his pelvic fractures and his sacral ala and ilium fractures. Larry was pretty miserable. He went from riding his bike about 120 miles a week to being bedridden. He was very frustrated. He didn't understand why he was in so much pain and why he couldn't get up and get moving right away. He was done on an outpatient basis, so we had all his preoperative plan and CT scans organized. He was brought in same-day surgery. He subsequently underwent consent for the procedure and anesthesia. He was placed to sleep on the hospital bed, and then he was transitioned prone. At that point, what we did is we marked out the bony landmarks on the patient. We place a small little incision. It's about 1.5 centimeter incision down through skin, and we bluntly dissect. And then we use these guide pins to kind of come across and make sure we place them in and around the sacral iliac joint to include the ilium. In Larry's case, he had fractures of the ilium and fractures of the sacrum, so we wanted to make sure we had screws well positioned to help stabilize the fracture, to get a good repair of the fracture and to be able to fuse the SI joint. Many patients with sacral insufficiency fractures have significant pain and disability. They are often bedridden, treated in the hospital with narcotics and attempted physical therapy. Because of this, I started using the iFuse implant. I've noticed immediate improvement in patients' pain, their ability to mobilize. The sooner we get these patients with these injuries mobile and off of narcotics, the shorter the hospital stay and the quicker route for patient independence. Larry's recovery went very, very well. The moment he had the iFuse TORQ implants placed and stabilizing the fracture, he was able to walk without significant pain. He transitioned from a walker to a cane relatively quickly, and at 2 weeks post-op, he didn't need any gait assist device. He was very happy. He's ambulating freely without any pain at all. He's able to sit without pain, and he's looking forward to getting back riding his bicycle with his group and getting back to 120 miles a week.
My recovery, again, as I said, for years I was a triathlete, and then I'm being active and I always pushed myself into physical therapy. That more than anything was, I can say, you know, was one of the big reasons that I'm here right now, because I'm just doing really, really well. Plus having Dr. Swift and having the surgery that I needed. One couldn't happen without the other, okay? You know, had I not had the proper surgery and, you know, all the physical therapy in the world wouldn't matter. I would tell another patient unequivocally, couldn't be in better hands than with Dr. Swift, okay?
I believe that using the iFuse TORQ implant creates a stable platform that is done minimally invasively, that provides a lot of fracture fixation and stabilization of the pelvis.